For a diagnosis that requires the patient to meet 5 of 9 diagnostic criteria, there's over 200 ways a patient could meet that criteria. So that's a lot of variability. In the December issue of Psych News, there appears the first of a 2-part series I've written about work that's ongoing right now to create the next iteration of the Diagnostic and Statistical Manual of Disorders, or the DSM. The DSM is a product and publication of the APA, and it is very arguably the most important document in the mental health field. A sort of overarching goal of the next iteration is to refine the diagnoses so that they more holistically capture the clinical reality of a patient. Currently, the DSM has a categorical system of diagnosis. People who vary considerably can have the same diagnosis. And at the same time, a patient can meet more than one diagnosis. It's important to note, however, they're not going to burn the whole thing down and start from scratch. The categorical diagnoses, which are very useful and have been used by clinicians, will remain. And they are more than just useful, right? There are patterns in nature. Patients who meet the criteria for a diagnosis do tend to cluster around a constellation of symptoms. So those categorical diagnoses will remain. The idea is to provide clinicians with some assessments that are clinically appropriate and relatively easy to use that might better holistically capture the clinical reality of a patient who comes for help.